'Cause I haven't got time for the pain. If there's one thing that I've learned in my time, both in working with and dealing with runners and from being a runner, is that we really don't have time for the pain. And there are so many different running injuries and issues and things that crop up far too often for many of us. And one of the more common kind of minor maladies that pop up over and over and over again are different types of tendinitis. So today we're going to do the quick rundown of kind of what tendinitis is, what some of the signs and symptoms are, and then next week I'll be giving you the scoop on how to treat and deal with your different types of tendinitis. So when it comes to runners, kind of the two most common types of tendinitis are Achilles tendinitis, which happens on the back of your foot, kind of between your calf muscle and your heel, and patellar tendinitis or tendinitis in your knee, sometimes referred to as runner's knee, although there's kind of a blurred line between runner's knee, whether it's tendinitis or whether it's IT band syndrome. So I try to stay away from that runner's knee label. But patellar tendinitis or knee tendinitis can happen typically below the knee, between the kneecap and your shin bone. And there are definitely many other types of tendinitis that can flare up in runners, but these are definitely two of the more common ones. But in any event, any type of tendinitis, what you're dealing with is an inflammation or an irritation. That's what the suffix itis means when you're talking about medical terminology. So anytime you hear any type of itis, whether it's bursitis or plantar fasciitis, or in this case, tendinitis, we're talking about something that's being inflamed. And obviously with tendinitis, you're talking about an inflamed or irritated tendon. So what is a tendon? In its simplest terms, a tendon is the piece of connective tissue that attaches your muscle to your bone. And so with repetitive motion movements, that's why you're going to see tendinitis so often, because the same muscles are making their body go through the same motions over and 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 over. And that's one of the main causes of tendinitis. It's that constant use that can lead to some irritation, and over time and over continuing to do that same motion over and over, that irritation builds up, that inflammation starts to build up, and you'll start to get some of those symptoms of a certain type of tendinitis. So what are those symptoms? Well, a lot of times it's going to be pain, certainly. It can be sharp, it can be kind of dull and achy. It depends on the severity and the location, and certainly on what you're doing. Now, giving a generic signs and symptoms kind of report of tendinitis is tough, and each case is going to be a little bit different. So if you're experiencing some of these symptoms or some of these issues that you think might be tendinitis, it's definitely worth your time to get it checked out. But if you want to try some things that you can do on your own at home that might help to relieve your symptoms, make sure you check out next week's video, where I'll be giving you some tips to help reduce the symptoms of different types of tendinitis. See you then. Now I haven't got time for the pain. I haven't got room for the pain.